Welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. So let's talk about hands. We always talk about face and rhinoplasty and hand and facial rejuvenation, but what about your hands? Actually, they are an incredible telltale sign of aging. So this is a very often and common adjunct that I do with facelift surgery, because often if I'm doing a facelift, I'm harvesting fat. So I'm using it for central facial fat augmentation. And the best way to rejuvenate the hands by far is to replace like with like. So I'm adding fat. So this works beautifully. And I've actually talked about it, I've written about it, and I've done hundreds of these patients, both singularly, but most commonly with a facelift. Because often if I bring it up, and often I actually forget to bring it up, but my patients sometimes do, and I'll say, hey, what about your hands? And they say, absolutely, I want to do that. So hand rejuvenation with fat is a game changer for facial rejuvenation and hand rejuvenation, because they can be done simultaneously, and the recovery is similar. In fact, the recovery for hand rejuvenation with fat is very, very minimal. And I'll go through the recovery for that. The key is, you know, I'm actually also, a little known secret is that I'm also a hand surgeon and a craniofacial surgeon, but knowing the hand anatomy is very, very important. And I've obviously written about this and published it. And basically, you're going to put the fat in the subcutaneous tissue of the hand, which is a very mobile area of the hand, and you can see that, and you can feel it. And as we get older, you can see, you can get, your skin gets thinner, and also you can see the dorsal veins, and you get atrophy. And the beauty of fat augmentation is that it's a dual purpose. Not only does it correct that visibility of your veins, but also it actually restores some of the dermal thickness because of the stem cells that are in the fat. And that's the beauty of dorsal augmentation with fat. It's by far the best. So I'm just going to show you how I do this.
Very, very common thing, and it actually allows you to use all the positive effects of fat grafting or growth factors.
And so what I do, and I do this often before I do the facelift, I'll harvest the fat from the inner thigh, and then I'll put in 20 to 30 cc's of fat in this area. And really, the amazing thing about it is that then you massage it distally and proximally, and it goes all the way to the wrist. And the amazing thing that I've heard from my patients is that they say, wow, my wrist feels so much better, my fingers, it's amazing, and you can see that. And then here's an example of this patient at 3 months, just to show you, the resolution of some of the venous spots and the filling in of the intercarpal spaces. It's pretty dramatic. And often I'll do it with, like I said, with a facelift patient. And so it's a very common procedure I do. And here's just an example of a patient that I did very recently. And I'm harvesting fat anyway for the face, so it makes sense to do it for the hand. So, and both are, fat is by far the best augmentation, the best filler for the face and for your hands, by far. It's beautiful. And there's just this lady that is a secondary facelift patient that I did recently, and so she's had a previous facelift, and she is now post-op from her facelift and her hand rejuvenation. She's got beautiful shaping of her dorsum, of her shape of her cheeks, and her jawline is beautiful. So we shaped that, and of course here's her hands again. Really looks beautiful. So I think the key thing here is these can be done simultaneously. Now, if a patient is not wanting to do it in the operating room, there is another alternative, and this is called calcium hydroxyapatite, and this is radius, and I blend this, and so I can do this in the office, and this is it looks like it has some discomfort, but really it's actually quite pain-free to do, just with topical. And so this is calcium hydroxyapatite that's blended 5:1, and I'll inject this in the office, and it works It works very well. Obviously, I don't think, and the patient knows that it's not quite as powerful as a as facial as fat augmentation, but it works very well. And this is actually commonly seen in the literature. So it's a patient that didn't want to have facial fat and didn't want to go to the operating room, and so this works very well for this as well. So this is a biostimulatory agent, so this is actually helps for collagenesis, and it works great for these areas. So I would say this is a great alternative to fat, because with fat, I usually take them to the operating room because that's to be done in a sterile environment. So it really works well, and it looks good, and this just shows this again in the same area. So I think, these are very good alternatives. And obviously, you need to go to a board-certified plastic surgeon, a dermatologist, or someone that is an excellent injector in this area that really understands the power of both the use of a filler. Now, you can use calcium. I like to use calcium hydroxyapatite since it's a biostimulatory agent. You can use an HA. There are several HAs that are approved for that, hyaluronic acid, but I actually like this much better. So I think this is a very good alternative. But fat by far is by far the best. So this just shows that. And then, so that's the gamut of combination hand and facial rejuvenation with the common denominator of fat. Fat is the game changer in all of modern facial rejuvenation. It's the best filler, it's your own filler, and it has all of the great growth factors, the stem cells, the precursors, all of that will make you look so much better. And I think that's really the key thing. So know before you go. So when you're coming to see us for facial rejuvenation, ask about your hands. The hands are really golden, and they can be corrected along with your face so that there'll be no more telltale signs. You'll look 40 or 50, and so will your hands. So give me your comments, leave me your messages, and thank you so much for tuning in to Rohrich Knows podcast. And if you like this, you'll also like seeing my podcast that's actually going to be on rhinoplasty and facelift surgery, another dynamic duo. Till next time, stay safe, stay informed.